Hello and welcome to the coronavirus update for the 9th of June 2020, where there are now over 7 million cases in the world, not quite 500,000 dead yet, 2 million cases in America. And weird things are happening in the wide world. Feels like something's changing, and I'm not entirely sure what it is. I've got two suggestions of maybe what's going on here. So the first thing I'm going to go take a look at is just the ratio of the total number of deaths with confirmed cases. So that's a number I've been keeping track of for some time, since before there was only 1 million cases in the world. And yeah, there the death rate was about 3%, went all the way up to about 7%, and it's been steadily declining till now with just about 7 million cases. It's 5.5%. However, you can do something a little more sophisticated than that. You can say, how many extra cases did I get here? At about 7 million cases. And, so it's in this case, it's about 1 million. How many people actually died? And so you basically look at the death rate at this point, this point, this point, this point, and so forth. And you take a look at that, it looks like this. So this is the sort of instantaneous mortality rate of the virus, and it peaked at over 10%, and now it's all the way back down to about 3%. So this is probably, as detection is getting better, the apparent death rate is going down. So, the detection rate is, 3 times what it was, when there were only 2 million cases in the world. And it remains to be seen how far this goes down. I mean, presumably it can't go down forever. It's got to plateau out at some point. But what the hell's that point going to be? Another way you can sort of see this is if you just look at the American statistics. So you'll recall this is another one that I've been looking at for some time. This is days past peak and the confirmed cases in America. And at first, I made my prediction that it was going to be down here when you hit the state of emergency line. Then I made another prediction on the 4th of June, and it looks like it's kind of quit. The number of cases in America, let's take a look at those. Yeah, so that data that I was just plotting up there is basically this. It's the number of cases, new cases per day, and it's really not going down any. However, if you take a look at the deaths in America, which is here, so the purple is my modified prediction line, and it's pretty much on track for somewhat over 120,000. But the thing is, that's not sort of diverging like you would expect if it genuinely was a sort of fixed mortality rate. So there's, it looks like the mortality rate continues to drop, and it's below 1,000 per day now. Just still, if you think about it, 9/11 every 3 days or something. But it's down to somewhat below 700. And this is the actual data. So whether this continues to go down or whether it plateaus out, it remains to be seen. But at the moment, it doesn't look like the deaths are reflecting the detected cases. This suggests there is an increase in detection. So all these things are sort of pointing to almost a threefold increase in detection of the virus. This is worldwide, by the way, is what you're looking at here. But the other thing that is super weird is you take a look at all the countries in Europe, the early cook-up countries, and they're all pretty much of a muchness. It's a big peak. And then, over the next month or two, it's got down to about 1/10 of whatever the maximum was. You take a look at, actually, France is a bad one. They've got weird ways of reporting. But Germany, peaks out, goes down to 1/10 of what it was. Italy. Yeah, even Italy is sensibly under control now. But you take a look at America, and looks kind of different. And Brazil Brazil, by the way, apparently have stopped reporting their statistics because, they have their Bolsonaro who says coronavirus doesn't exist, which now means that Brazil, where they were peaking out at 30,000 new cases per day on a population that is only 2/3 the size of the US population. And, America is down, it's getting down to about 20,000 new cases per day. So Brazil is really the worst country in the world at the moment. And, Russia looks kind of the same. They went up and they plateaued. So it's not clear why these countries look different. Now, I've heard a couple and the other thing that stuns me is there hasn't been more of a rebound in Europe. I would have expected these numbers to have started going up again because basically everyone has almost completely relaxed the social distancing regulations. So, why didn't it explode like it did earlier? And I've heard some people suggest that it's the weather, which, it might be a factor. Another one, which is possible, and I've heard this bounced around, is that basically everyone had the virus. It wasn't sort of 1% of the population had the virus. It's loads of people had it. I'm a little uncomfortable with that. Doesn't feel right. You look at the numbers around the world. So another one which I heard, which for me gels maybe a little better, is that the majority of what you were looking at here were essentially super spreader events. It's some sort of highly infectious guy goes to a concert or something, and those were the key events that spread the virus. So it's not so much that, most of the quarantine social distancing measures are kind of pointless, but if it's the super spreader events, so there's been a load of the cases in Germany were all tracked back to, a church where it's, they're all together in a room and infected some huge number of people. And similarly in America. So it's more about avoiding the mass gatherings is maybe. I mean, this is pretty speculative stuff, but you see what I mean? It's different in Europe than everywhere else in the world, and it's not entirely clear quite why that is. How's Canada doing? Okay, so now there is actually a divergence between how Canada is doing and how America is doing. Canada is down to sort of 50% of its max. US, 30% down maybe. But there's another thing that I wanted to touch on. Actually, I'll do it tomorrow, and that's this remarkable thing where the Lancet put out this study on hydroxychloroquine, and it turns out that it's mostly bullshit, which is stunning, seeing as it's one of the world's most prestigious medical journals and so forth. I mean, the hydroxychloroquine is a waste of time. At this point, the medical trials would have come back and said there was some effect, if there was some effect. So it's one of those ironies that even though this retracted study said there are no benefits from hydroxychloroquine, the study was complete bullshit, but it's probably the right result. Anyway, I'll go over that in some more detail tomorrow. So that's the update for today. If you found that useful, drop a thumbs up on it, would be nice. And thanks for watching.
A young man walks into a hospital in San Francisco, circa 1918. He's just got back from the trenches in Europe, and he's excited to see his family again. His mother has sent him to the hospital because of his constant fever and fatigue. She kisses him on the cheek as he leaves, but little does she know that in just a matter of a few hours, his skin will turn blue, he will bleed from his eyes and ears, and in the dark hours of the morning, as he remembers his friends suffocating on chlorine gas in Belgium, his lungs will fill with fluid, and he'll drown, cold and alone on the floor of a San Francisco hospital. Today's topic will cover a specific viral outbreak. What measures did we take to slow its advance? What did we fail to implement? The best thing we can do in any outbreak is to limit our contact with others and practice good hygiene. And with that out of the way, let's get into it. The Spanish influenza, or Spanish flu, according to many historians, was the worst pandemic in world history, comparable even to the Black Plague in total deaths. The Spanish flu came across the land in 3 waves. The first, in the spring of 1918, was considered pretty mild and was limited in scale. The second wave began in August of the same year, mutating into a more deadly strain and spreading to a global level. We saw the third wave in the beginning of 1919, but it was contained in a handful of regions. Now, many attribute anywhere from 50 million to 100 million deaths to the Spanish flu. 100 million is an enormous amount of people. Consider that the total casualties from the Great War sits around 40 million, and that was a catastrophic number of people. Then, is the Spanish flu still the worst pandemic in history? The plague killed around 50% of the Eurasian population in a 4-year period, with total death estimates sitting around 75 to 200 million. The equivalent today of the entire population of the UK, Germany, and France combined. Suffice it to say, a mythical amount of people died from Black Plague. Death count isn't everything, though. The Spanish influenza pandemic is more relevant to us today than the Black Death. Germ theory was developed in the late 19th century, and our method of treatment for the sick were a little bit more advanced in 1918 as they were in 1347. We no longer believe illness is spread by evil spirits, or bad smells, or, too much blood in our bodies. It seems obvious in retrospect that the influenza pandemic is nothing to scoff at. But with all global crises, the question is, did we respond quick enough, strong enough? Will future humans look back at us with disdain, or will they applaud us for our quick action? Author and historian John Barry wrote that the US government used the same strategy for communicating about the disease that it had developed to disseminate war news. That is, an executive order to control all government communication strategy during the war that was premised on keeping up morale. Well, according to Barry, keeping up morale meant that the US government primarily lied, covered up the truth, and misinformed people. The stance of the American government can be seen through the words of Chicago's Director of Public Health: "Worry kills more than the disease." Now, that might be true in some cases, but the US military was very keen on keeping people at work. It's hard to fight when factory workers at home aren't manufacturing weaponry because they're all dying of disease. So containment was limited to information, not the illness. This disinformation campaign resulted in almost the complete opposite of what they had intended. Barry writes that absenteeism reached extraordinary levels. It crippled the railroad system, shut down telephone exchanges, grocers refused to open, coal cellars closed, to the point that the Red Cross reported that people were starving to death, not for lack of food, but because the well were too panic-stricken to bring food to the sick. Journalist Skip Desjardins writes that the most critical lesson from the Spanish flu era is that the government and society can never be sufficiently prepared for a pandemic. Without the information ordinary people needed to keep themselves safe, trust between citizens broke down. And even when the corrected information was provided, citizens couldn't trust what they were being told, which made it even harder to implement important public health measures. Desjardins tells of a Dr. Milton Rosenau, who took all the precautions so familiar today: testing, quarantine, medication, and identification of anyone who'd had contact with those infected. But math overwhelmed science, and cases multiplied faster than doctors could stop them. Soon, every Massachusetts hospital was closed by overcrowding, public gatherings were canceled, and undertakers ran out of caskets. The sad truth of the matter is that sometimes governments won't prioritize the right things. The reason that this illness was even called the Spanish influenza is that Spain was a neutral party during the Great War and did not have the same censorship laws that the other participating countries had. Despite the fact that there was no consensus on where the illness originated, Spain was blamed for the flu at the time, simply because it was the only country willing and able to report on it. Even today, historians debate where the Spanish flu could have come from. Some point to a training camp in Étaples, France, some to a military base in Kansas, and others blame Chinese migrant workers en route to Canada. Knowing where a disease comes from is important because it helps us contain it and measure its efficacy. But determining how deadly a pathogen can be is difficult because we often don't know the real statistics until much later. So we need to be very careful about when and where we get our information. The CFR, or case fatality rate, is important to know, but it doesn't actually tell us that much about how dangerous a pathogen is. What made the 1918 pandemic uniquely dangerous was that it affected people in their late 20s significantly more than any other age group. Alain Gagnon, a professor with the Université de Québec à Montréal, found that the yearly ages at death during the fall wave of the 1918 pandemic in various locations in Canada and the USA report a peak at the exact age of 28. He argues that individuals exposed at least once to the 1889-90 Russian influenza pandemic strain had abnormal fatal immune responses to the 1918 outbreak. Exposure to a different influenza strain in infancy created a crack in the defense of many young people who, when exposed to a secondary deadly influenza strain almost 30 years later, could not generate the right immune response, suffered from a secondary infection, and died. Now, the CFR of the Spanish flu was around 2.5%. So how does the 1918 flu pandemic measure up against other epidemics? The 1957 flu pandemic, the 2009 H1N1 outbreak, and the seasonal flu strains all have CFRs lower than 1%. SARS had a CFR of 10%, MERS was 30%, Ebola has, currently, a CFR of 50%. By and by, the flu of 1918 was the worst flu pandemic in history, but it is by far not the most deadly pathogen out there. Of course, I'd be missing an opportunity if I didn't bring up the world's current situation. COVID-19 has a CFR of approximately 5.1% as of the beginning of April. It appears as though it is twice as deadly as the 1918 Spanish influenza, but COVID-19's global fatality rate is still in flux. Many factors can cause a CFR to vary from one country to another. Things like healthcare funding, population density, infrastructure, media coverage, and government action all change from nation to nation. So a global fatality rate doesn't tell us as much as we want it to. For example, Canada sits at a low 1.17%, the United States at 2.16%, China at 4.06%, the UK at 7.98%, and Italy with the highest at 11.75%. Those numbers sound scary, huh? But try not to get too alarmed by them. The problem with calculating a CFR in the early stages of an epidemic is that it's difficult to record the number of total cases accurately. Not every case of COVID-19 has been accounted for. We don't have consistent access to testing, and we cannot test everyone. Many cases are flying under the radar. These are figures that would categorically shift the CFR significantly, possibly making it much lower than currently estimated. So these numbers really don't account for everything. By contrasting the Spanish flu pandemic to COVID-19, you're comparing century-old data with incomplete data. And that sounds a little silly, doesn't it? We are currently in the grip of a new pandemic. And the good news is that measures that many countries let slip to the wayside in 1918 have already been implemented today. We also have a much more robust healthcare system and a better understanding of the human body, diseases, and science in general. There is something to be said of our global community, though. We may not have hundreds of thousands of soldiers returning home from disease-ridden trenches, but we do have a global tourism industry. We are learning more and more how connected we are to the rest of the world, not only through politics and trade, but through our health as well. We are all one community, and shifting blame does nothing to protect ourselves or the people we love. We just have to do our part.
On the morning of March 28th, Domingo Vega of Queens, New York, went to the hospital with symptoms of pneumonia and tested positive for COVID-19. This is Domingo, but not just him. This light represents 500 people who have been infected with the novel coronavirus in New York City. By May 16th, there were nearly 190,000 known cases of COVID-19 there. Health officials report these numbers every day in cities and countries around the world, but they know that they're incomplete. Because COVID testing has been like a narrow flashlight in a dark room. Anything we're not pointing the light at, we can't see. But now researchers are collecting data that can capture the pandemic more fully, to try to get a better handle on just how much we've lost.
Limited. 25, okay? Bye.
Domingo Vega died on April 16th at the age of 45. Originally from Mexico, he came to the U.S. when he was 16 and worked in restaurant kitchens since then, eventually launching his own business with 2 locations in Brooklyn. He and his wife had 3 children. Domingo was one of 20,720 New Yorkers whose lives were cut short by the coronavirus as of May 16th, according to the city's count. Each blue light represents 500 known deaths from COVID-19 and 500 families who don't need data to tell them how dangerous this disease can be. But when it comes to the statistics, that question, how deadly is COVID-19, has been difficult to answer. The relationship between the known deaths and the known cases is called the case fatality rate. At this point in New York City, 1 out of 9 people known to have COVID-19 have died. That's 11%. But that rate varies drastically across cities and countries. It was over 12% in Sweden in mid-May, but less than 1% in Iceland. And it also changes over time. For the US, it dropped down to 1% near the end of March before climbing back up, as people who tested positive several weeks prior ended up dying. When the case fatality rate varies this much, it's saying a lot more about these countries than about the disease itself. For example, deaths may be higher in places where the health system is overwhelmed or where the population is older. We know that COVID-19 is more deadly in seniors, and especially those over 75. But also, on the other side of the fraction, the rate reflects how much testing is happening. If a country is aware of more non-fatal cases, their case fatality rate is lower. So this statistic isn't all that useful because we know most countries are missing cases, and we're learning that we're also missing deaths. According to an estimate by the New York Times, there have been thousands of deaths that weren't included in the official count for New York City. We don't know for sure if it was coronavirus that killed them, but here's what we do know. If you look at 2017, 2018, and 2019, and chart the average number of deaths per week, the line looks like this. It includes deaths from all causes. For 2020 so far, that line of weekly deaths looks like this. The area above the typical level is called excess deaths by researchers, and it gives us a fuller picture of the cost of this pandemic. We're seeing excess deaths in many places that have suffered big outbreaks. In each case, the excess deaths are higher than the official count of COVID deaths. It includes people who may have died from other causes, but who were unable or unwilling to access medical care because of the pandemic. But it also includes some people with coronavirus who weren't counted because they died at home or in care facilities or were never diagnosed. As this data comes in, it shows us that in some places, the pandemic is even more deadly than we thought. But the virus itself may be less deadly, because we're also learning that a lot more people have been infected than the official tallies show. Health officials in New York have taken small blood samples of people at grocery stores to check for COVID antibodies. This is called a seroprevalence survey, and it helps capture the substantial number of people who didn't know they ever had coronavirus. So far, these tests show that around 20% of people in New York City tested positive for antibodies that indicate a previous COVID infection. If those shoppers are representative of the city's population, that would mean there were more than 1.5 million COVID-19 cases in the city by early May. Without changing how many people have died, the antibody survey lowers the fatality rate by identifying more non-fatal cases. Remember, the case fatality rate was 11%, or 1 in 9. But the fatality rate for all of those who've been infected may fall somewhere between 1 in 60 and 1 in 90 for New York City. So while the death count is higher than we thought, the death rate may be lower. But a low fatality rate is not all good news. It paints a picture of a tricky virus that moves undetected through many of us and causes immense suffering and death in others. We can look for comparisons to try to wrap our heads around the death toll. More people lost in 3 months in the US than a year's worth of car crashes or drug overdoses, still fewer than the annual deaths from cancer or heart disease. But the comparisons are limited. Because unlike car accidents and cancer, COVID-19 is contagious. Human beings are the vector for this disease, and their actions are hard to predict. So even with better data on how many are infected and dying, we won't know the full death toll of this pandemic until we find out how it ends.
Our own Richard Wilkins has tested positive to coronavirus after meeting with Hollywood star Rita Wilson.
Yeah, this comes as today extra hosts David and Belinda spent the weekend in isolation awaiting their results. We'll speak to David and Belinda in just a moment, but first to Richard Wilkins, who joins us via FaceTime. Good morning, good sir. How are you?
I'm surprisingly and very well, Carl. Ali, good morning to you. Good morning to everybody. Look, you could have knocked me over with a feather last night when I got that call. It took me a couple of minutes to reel from the news that they gave me, but I feel fine. I feel 100%. I feel the same as I always feel. I don't have a sore throat. I don't have a runny nose. I don't have a headache. I feel terrific, and yet I've obviously contracted this thing and tested positive for it.
So this is what's actually, you know, in my mind a bit scary, Dickie, is that, you know, you were feeling completely fine. You had none of the symptoms. And then it just sort of makes me wonder if you're out there with a positive result, are there perhaps others who don't know they've got coronavirus?
Well, I wouldn't have got tested. I went and saw Rita, and we're assuming this is from Rita. It may not be. I mean, they've all said it could be anyone, anywhere, anytime, such as the prevalence of this thing. But I went and saw Rita briefly at the Opera House. She was in your studio, as you know, this time last week, rehearsing during the commercial breaks for a performance on the Today Extra. And, you know, I was having a chat to her, and, you know, that's probably my best guess as to what happened. But, you know, it is, as you say, a terrifying thought. And I wouldn't have got tested unless, you know, I posted a selfie and we thought, well, we should go and get tested. And once you've got tested, you need to wait for the result. So I had a weekend at home, which, as you know me well enough to know that a bit of self-isolation, I never mind. But, you know, here I am. And last night having to call my kids and tell them the stuff wasn't much fun. And, you know, the weird thing is that what you want to do more than anything in the world is hug your kids at a time like this, and that's the last thing you can do. But, you know, if there's a message there, this is wild. This will blow you away. Rita's band leader and guitarist, who was in the studio, who I actually introduced you to, Carl, he's back in the States. He can't get tested until he shows symptoms over there. And his wife works in a hospital. So Ali's point is well made. God knows, especially in America, I hate to say it, that there could be a lot of people wonder. I'm not suggesting he is for a second, but, you know, when you can't even get tested and you've been working with someone who has tested positive is a terrifying thought, isn't it?
It seems to me, Dickie, and this is why it's very difficult, because they don't know everything about this and how it's transferred and transmitted at this point.
Nobody does.
No,
Nobody does.
And you and I spoke at length on last Monday and to the band leader, and you also spoke to Ali. But they say that if we're not showing any symptoms or signs, then it's quite feasible that we don't have it.
I don't think you've got it. You know, everybody I've spoken to, they've said, well, you're not going to pass it on until 2 days before you started showing symptoms. When did you get sick? And I said, I'm not sick. I don't have any symptoms. And they said, well, you may not have. You know, maybe I'm going to get sick tomorrow. I don't know. I'm almost sort of like waiting for something to happen.
Yeah.
But you know, they've also said that in the early days, they didn't think people were asymptomatic, but it now turns out that they are. So, I mean, if I can say anything to anybody, if this is obviously it can get worse than this, but if this is what it's like, then so far so good, dare I say.
Hey, and Dickie, you were saying, you know, when you told the kids about the positive test result, what was their reaction, and what does it now mean for them and your kids that you have come in contact with? Do they now need to self-isolate for a certain period of time? Do they now need to go and get tested, even if they're not showing symptoms either?
Well, I haven't seen. The only one I've seen in the last couple of weeks, which is a bit sad, isn't it? The only one I've seen in the last couple of weeks was Christian, who of course is based in Melbourne doing the dancing show. He came home briefly on last Tuesday and raced upstairs. He was exhausted, and then we didn't see each other on Wednesday, and then he was back in Melbourne. I called him after his show last night, and he was and still is, you know, very, very upset, obviously, and you know, he's going to get tested in an hour, and fingers crossed he'll be okay, which I'm sure he is. But, you know, it's not a pleasant conversation to have with the people you love most in the world.
Dickie, I feel for you. I genuinely do, and we love you so much. And I think that's the hardest thing is that you feel like, oh my God, I mean, you can't do anything about getting this, but it's who that might get it from you that you feel most aggrieved about.
Yeah, well, that's weird. You feel sort of guilty and embarrassed almost. You know, I went and did a piece with Fitzy and Whipper, the wacky Sydney radio guys on Nova last Thursday morning, and they're off air today. I had to ring them last night and say, hey guys, guess what? So, you know, the ripple effect of this thing is enormous, and you know, I pray to God I can get rid of mine, and I just pray to God I haven't. Well, no one else has got it because of me, but you know, everyone I know in the whole wide world has contacted me in the last 12 hours, I suppose. And I keep saying I'm sorry, and they say, hey, it's not your fault. This thing is not because of you. And I think that for the people who have got it, I think that's important too. I mean, I'm sure Tom and Rita feel bloody terrible.
Yeah.
They've done nothing wrong. No one's done anything wrong. We're all in this together. The one thing I do think is, you know me, guys, I'm pretty, you know, I live a relatively healthy lifestyle. I go to the gym. I've been working out on the treadmill over the weekend. You know, I think having a good immune system is probably incredibly important in dealing with this thing if you're unlucky enough to cop it, I think.
Well, Dickie, go well. We love you so much, and we'll be in contact during the day and night, and take care of yourself.
Good on you. Thanks, guys. See you.